Welcome back to another Nursing Mindset video, where we will discuss nutrition. When most people hear the word nutrition, they think about healthy eating, dieting, or counting calories. As nurses, we think about nutrition a little differently. We recognize that every bite has the potential to promote healing. Nutrition isn't simply about food, it's one of the most powerful therapies we have to help patients recover, maintain health, and prevent complications. Take a look at the graphic. At the very top, you'll see the phrase, nutrition matters. Every bite has the potential to promote healing. I want that to become your mindset every time you care for a patient. Think about it. A patient recovering from surgery needs protein to rebuild tissue. A patient with heart failure may need to limit sodium to reduce fluid retention. A patient recovering from a stroke may require a modified diet to reduce the risk of aspiration. A patient with diabetes needs to understand how food affects blood glucose. Different patients, different nutritional needs. But every one of those patients depends on nutrition to heal. Before nutrients can help the body, they first have to be digested and absorbed. You'll notice another reminder on the graphic. The digestive system breaks down food, absorbs nutrients, and eliminates waste. One important fact to remember is that most nutrient absorption occurs in the small intestine. Now, once nutrients are absorbed, they become the building blocks for energy, growth, tissue repair, immune function, and healing. That's why nutrition affects every body system. So how do nurses approach nutrition? We use the nursing process, of course. Everything begins with assessment. But here's where I want you to think a little differently. Nutrition isn't just asking, what did you eat today? It's looking at the whole patient. We're assessing weight trends, laboratory values, swallowing ability, physical assessment findings, diet history, medications, access to healthy food, and even the patient's ability to prepare meals after discharge. A patient can appear overweight and still be malnourished. A patient can have a normal weight and still have significant nutritional deficiencies. That's why we never rely on one assessment finding. We look for the complete picture. After we've gathered information, we move into analysis. This is where clinical judgment begins. Imagine two patients. Both have diabetes. One is a busy college student who skips meals and eats fast food because it's convenient. The other is an older adult who lives alone, has limited income, and can't easily shop for groceries. Same diagnosis, completely different nutritional challenges. That's why nurses don't just treat diagnoses. We actually care for people. Our assessments help us understand why a nutritional problem exists so we can develop an individualized plan. Implementation often looks different than what students expect. Sometimes it's teaching a patient how to read a food label. Sometimes it's encouraging a patient to sit upright before meals to reduce aspiration risk. Sometimes it's helping a patient choose foods higher in protein to promote wound healing. And sometimes it's simply creating a calm environment so patients feel comfortable enough to eat. Small nursing interventions can have a tremendous impact on recovery. You'll also notice several practical reminders on the right side of the graphic. My Plate provides a simple framework for balanced nutrition. Food labels help patients compare products and make healthier choices. Remember this easy rule you'll learn in class. 5% daily value or less is considered low, or 20% or more is considered high. These are practical skills that patients can use every time they shop for groceries. Finally, we evaluate. Every nursing intervention should end with one simple question. Did it work? Is the patient meeting their nutritional goals? Has their weight stabilized? Are they eating more? Are laboratory values improving? If not, we reassess, we modify the plan of care, and continue working with the healthcare team. Evaluation isn't the end of nursing care. It's what tells us whether we're making a difference. I'd like to leave you with one final thought that's highlighted at the bottom of the graphic. Nutrition is one of the most powerful therapies we don't administer from a medication cart. As nurses, we often think about medications as the primary treatment. But nutrition supports wound healing. It strengthens the immune system. It provides energy. It promotes recovery, and it improves overall health. Every time you encourage a patient to eat after surgery, teach someone how to read a nutrition label, recommend foods that promote healing, or recognize that poor nutrition is delaying recovery, you're using nutrition as a therapeutic nursing intervention. So remember, nutrition isn't simply about food, it's about helping patients heal, recover, and live healthier lives. That's the nursing mindset. Keep developing yours.